So Dr. Bregman, this is a topic that I think unfortunately will ring true with a lot of Americans staying home. And that is the topic of alcoholism. We're under so much stress. Self-isolation is not helping. Not having to go to work tomorrow enables us, and it enables us in our bad habits. One of them, drinking alcohol. And this email from Peggy, who lives in Denver, reaches out and she says, I've always been a social drinker. I would just drink on weekends and never have enough or never get to the point of getting drunk. These days, I'm really nervous about the virus. I'm nervous about losing my job. They haven't called me back yet. And my husband is getting on my nerves. In order to get through my anxiety, I drink every night. I'm worried because my husband says that I'm drinking too much, so I'm sneaking it behind his back. I wake up hungover and remain depressed throughout the day. I'm not sure I can stop. So her question to you is, am I an alcoholic?
Okay, well, there's always a lot of denial in alcoholism, people admitting that they're an alcoholic. I think some of the feeling questions are even better than, well, how many ounces do you drink? How many glasses do you drink? One thing is easy then. If you don't drink, do you feel bad? I mean, you must drink to feel okay. I mean, that's like very important. Can you stop? If you have to go to work, now we're reintegrating. Can you stop drinking, or do you have to sneak and lie and you have to go and get some alcohol? These are all telltale signs that this has really gotten out of hand. So, I mean, so then
what do you do? I mean, first of all, I guess like you're saying, someone watching this right now would maybe identify with some of the signs. And if they do, then how do they take it to the next step? I mean, how do they own it? And what do they do?
Well, a little bit more history. Does this person have a history of alcoholism in the family because it's highly genetic? Does this individual gone to substance or alcohol programs before, so they have a previous history? So we need to look at that. We need to say, do you have any medical problems that are interfering, which could be the cause? Do you have any underlying psychiatric problems that maybe are coming back again? So these are all things to think about. So you may need to go back to your psychiatrist if you're being treated before, see if you have any comorbid problems, or some medical problems. If not, then maybe the family itself needs to go to Al-Anon. You need to reach out to AA or hotlines, or go to a substance abuse specialist.
Okay, so let's turn the table around. Let's say I'm living with someone that has a problem. Obviously, if we're in quarantine, it becomes more obvious because we see them all the time. How do you go about approaching this loved one without angering them or insulting them? I asked this question personally because at the end of my father's life, he became a terrible drinker. And we did perform interventions that were really unsuccessful. So I wish I knew you back then, because I would ask this question for myself. How do you, especially with an A-type personality, how do you go about saying, hey, Dad, you're drinking too much. I need to help you?
This is a very important question, very difficult question. If it's the end of life, sometimes depriving somebody of something that gave them so much pleasure is not really a great idea. If it's really not, and this individual is really hurting that part of life, it's very difficult. You need to kind of really deal with the person with empathy. What I've done in my practice is I would take family members and bring them into the practice and start talking to them, and then kind of cajole the patient just to come along, but not as an identified patient, to make the person feel that they with good self-esteem, and then talk about it in the context of a therapeutic relationship. in the office. I found that to be very helpful. People who would have never gone kind of go because maybe their loved one happens to be going, an altruistic thing for them. And I would think about handling it in an empathic way like that.
Finally, it's not just maybe getting off the alcohol. It's like you said, identifying the problem may be of depression or anxiety, and therefore you self-medicate. So, maybe just going to AA meetings might not be enough. That's where you would come in and start to treat that underlying problem.
Absolutely. I think, and this happens quite often. People have underlying medical problems, they have underlying psychiatric problems, and it's exacerbating the drinking problem. So if that could be identified, even going into a family meeting that the person is not the identified patient, and other people talk about the individual being depressed, not getting out of bed, being very negative, not having any pleasure in life, and then to cajole that individual into seeking some treatment that way in the context of the family.
Great. Well, identifying the problem, owning the problem, and then getting help seems to be a great solution. Thank you so much, and I look forward to talking to you soon.
Yes, same here. Bye-bye.
Bye-bye.
BregmanMD Medical Group offers online psychiatry and online therapy.